Thank you very much, Judy. First of all, good evening to everyone, and my special thanks to both Judy, King, the whole organizing committee. This was, in fact, a very, very rich meeting with lots of content and lots of discussions that took place outside of each of the conference rooms. What I've been tasked to do was not easy. You just heard about educational innovation, the university enabling systems, and I was asked to address for you what was presented in science and technology. That sort of covered 5 plenary sessions, 11 out of 26 symposia, and 56 posters, and I could not do that all. And so I asked 4 people from my institution, Johns Hopkins University, to join me in this effort. And my thanks goes to them for David Peters, Noreen Hines, Nancy Glass, and Dick Dunning. Now, we've seen this graphic just about in every session. Because it underscores the diversity that is embedded in universities. So we have the research, we have the practice and service, the education and training. So where does technology and science fit in? At first I thought it's just the research. It's not. It actually is one of the driving forces that make the universities what they are today and for the future as well. And so if this was a Venn diagram, it's the overlap, it's the driver, and it penetrates into each of those aspects, and you'll hear that in my summary. The next part I wanted to mention was that while global health had its origins in tropical diseases, as we heard from Peter Piot, it has really grown, and it's now affecting just about every single health system that one could ever imagine, because it's addressing disparities and inequities across the world. And so the bottom line in science and technology is that it has to be multidisciplinary. We are not going to solve a single problem unless we form the teams that have the expertise to work together to solve those problems. Now, let me just put a few things on the table for discussion later on. And I want to start with Peter Piot's opening presentation because he called it Global Health 4.0. And he said in that presentation that global health's transitional right now. It's a continuing, evolving process. And what we talk about this year is going to be different than what we're going to talk about in Montreal next year. And hopefully we will have learned from this meeting to address some of the new challenges that we'll talk about next year. It's not really fully defined. There's debates in the field as to what really is global health, and it has an unfinished agenda that we'll talk about. Peter said in his presentation, and this resounded well with me, are we North American and European institutions with a global mission, or are we global institutions just happen to be based in North America and Europe? Or some combination thereof. And so Peter's conclusion for the future challenges was who's really setting the agenda in global health? Who gets the revenue from research, the multidisciplinary research, the academic credit, and career development? And I think in the discussions after many presentations, that really came up multiple times. Tasha Yamada in his presentation really hit on the science and technology. That's what the Gates Foundation is looking for. High-tech solutions with an immediate outcome and impact. And his resounding theme was innovation, innovation. And he also said this is evolutionary or it's revolutionary innovation. He underscored the latter. And he gave the examples of peptic ulcers and Helicobacter and malaria control and vaccine development. And somewhere embedded in his talk, I picked up on this one term because it doesn't always come out of the Gates Foundation as much as I'd like it to hear it. And it's that humanity's greatest achievement is not actually in the discovery alone, even though that's where the innovation pays in, but it's in application of that innovation to save lives. And sometimes that in itself has to be revolutionary. And then Chancellor Sue Desmond-Hellmann, who I knew as back in our early days in Uganda, really gave the paradigm of learning at the university as a student, graduate student, researcher, then moving to industry, and then coming back to university. This is a forward and backwards progress, and that one doesn't have to be static in one place. And that industry is an important partner to have for the university. But one, she put out the caution, you need to understand whether your sponsorship with industry is an initiative as part of a business product or part of their philanthropic enterprise. Hopefully it's probably both, but I'd rather it be on the latter than the former. I really have to give honor to Bill Popp. He really gave a fantastic presentation that defined for me global health. And the one word I pick out on that is flexibility. He started out doing diarrheal research, very important, and part of the backbone in the early days of global health and still today. But it then shifted because a new epidemic hit Haiti, the HIV pandemic. And then they have an earthquake, and he had to switch to emergency services. And as Paul Farmer said, he called him and said, for those who have lost everything, we have to give everything we possibly can to make a difference in their lives. There's no formula to collaboration between the North and the South to the South. Success is basic to the people who are working on both sides who have a common purpose, and that's improving the health of the poor. And the need to provide professional incentives and support for teamwork. Teamwork came up just about in many presentations, and it's what's necessary to promote global health collaborations. I'm going to shift to today. We heard about the numbers. Who's funding global health? And this is a little bit parochial in that I'll just talk about the U.S. for a minute, but you can see this gradual increase from 2008 up to 2004 to 2008 up to $96 billion a year by the U.S. government to global health. Fantastic number, and it can enable us to do a lot. Can we do more? Can we ask for more? I actually think we can. The federal budget on an annual basis is $3.4 trillion. Global health expenditures are about 0.3%. So I actually do think if global health is going to be part of our foreign assistance and diplomacy, I think we can advocate for increasing that number over time. There was a discussion as well that there's a tension as to the targeting of these funds and where they get placed. And actually, I think Wafa El Sadar from Colombia said it best, that if you can build the systems for HIV care, you can use those same systems for maternal child health, and you can build them for diarrheal care centers and vaccine distribution and so forth. This does not have to be one or the other. It can be everything if we're innovative enough. So I shift now to some of the symposia that have been presented. And chronic diseases is rising very fast on our agenda of global health. Tobacco control and the related diseases is continuing to spread and be major health problems internationally. John Samet from USC gave a fantastic presentation on the good news of what we're doing in tobacco control, and that's shown on this slide. And those who were at the meeting obviously heard this in much more detail. But there's a lot of bad news. This is a problem we're going to have to tackle, and we're going to have to use all our resources of the university expertise to really go after this. 1.2 billion smokers still in the world, and industry is still a threat to the developing countries of the world, and product diversification, not using our current tools for control. That was followed by Ezra Susser, who talked about the scope of global mental health problems. This is probably going to be, it's already a ranking cause of dailies, but it's going to rise even faster. And there's very little being done in this field in the international scene. And I just list a few of the ones that he identified as major threats to our society. And there is a scarcity of mental health services and generally a lack of funding to support those interventions to try and address this growing epidemic of mental health problems internationally. Now, you saw this particular graphic. Someone showed it. I'd show you the whole Economist. But worldwide obesity didn't get really addressed as much in this particular session, but it's one that's going to be growing as we know, 1 billion adults are overweight and 300 million adults are obese, 22 million children overweight, increase the risk for coronary heart disease, type 2 diabetes, cancer. Total economic cost is just astounding. So I think obesity needs to be on our global health agenda at the same time that malnutrition does, just showing the inequities around the world. The one session I really enjoyed, and unfortunately not many people could get into the room. In fact, many people were a little bit upset that they couldn't get in. So I took a couple slides with their permission to really underscore the importance of the growing science and technology that we're seeing today from climate and ecosystems. There really is global warming. And we have seen some of the risks that are associated with global warming. So this particular graphic just shows in the last several years this very rapid rise. The projections have been placed out. If you look at the scale, we're only talking 2 degrees, 3 degrees centigrade, and you're going, no, you know, so what, big deal. Seattle will be San Diego, as I heard, in just a year or two, in no short time. And this, I thought, was an interesting graphic that was presented, which goes back to year 1000 and projected out, and it shows the average global temperatures. This is global median temperatures. And what I didn't know is that we had a little ice age. I knew about the big ice age, but I didn't know about it. So I learned in this session an enormous amount and what the ramifications are. And if you look going back over 1,000 years, you can actually see how disturbing this really is. Well, this gets magnified many times when one starts to look at what its impact is on global health. So we're starting to see an increase in the spread of the vectors for malaria and for dengue and many other vector-borne diseases. We are starting to see an impact on crops, which is leading to increase in malnutrition. We're seeing increased number of people suffering from deaths, diseases, injuries from extreme weather events. Increase in the frequency of cardiorespiratory diseases from the changes in the air quality, which I'll mention briefly. And then the infectious disease vectors, as I mentioned. And of course, an increase in diarrheal diseases. So this gave us some of the years of life lost and years of life lived with disability by latitude. I've never seen this type of graphic before. And so if the purpose of the meeting of CUGH on an annual basis is to cross and spread information from one field to another field, this particular session did it for me. And it shows that many of the diseases that are typically more confined to the tropics will start to move in the latitudes, temperate latitudes, as warming continues to go up. All of this is being compounded by the rapid growth in our population, over 9 billion people projected, and the growth of urban cities. And the urban cities, show that with urbanization, we're starting to see more pollution. Obviously, with the movement of traffic and motor vehicles and so forth. Also seeing more problems with other risks in health.